The Growing Impact of Mental Health Issues Among Students by Shaylee, Kai, Miriam, and Madison. We believe that mental health issues among students are increasingly becoming a critical concern in educational settings. As the challenges grow, it is essential to recognize the signs and symptoms early to provide the right support. However, factors like misunderstood cultural perspectives, inaccessible policies, and undefined educator roles can hinder effective intervention. Addressing these barriers is key to ensuring that students receive the mental health support they need to succeed academically and personally. Identified issues, misunderstood cultural perspectives, recognizing signs and symptoms, inaccessible policies, and undefined roles of educators.
The rise in mental health concerns among learners is a significant issue in educational environments. Recognizing these symptoms is very important. Educator- Educators should look for the following symptoms, although this is not all of them. These are some of the main signs and symptoms that some children can show. They can be feeling sad for more than 2 weeks at a time. They're trying to self-harm or speaking about self-harming, constant getting into fights with other peers and v- showing signs of anger, noticing that they're not eating their lunch and are throwing up their meals, their difficulty concentrating on classwork, having severe mood swings, having big emotions, uh, dissociating from friends, not wanting to play with them, or staying isolated from other people. Their personalities can change drastically, where they're acting like a completely different person, and other things as well. Although mental health can be a complex thing to address and um, very hard to determine, educators can incorporate support strategies for learners who are struggling with mental health, and even the children who are not struggling with mental health. They can take certain training programs, look at certain websites that support their teaching.
Cultural difference can affect how students feel about mental health. In some cultures, mental health is not openly discussed, and there may be shame up around it. This can make students feel alone or misunderstood. For example, a student might avoid asking for help because their culture see it as a weakness. Teachers need to learn about this cultural difference by understanding and respecting each student's background. School can create a more supportive and inclusive environment. This helps students feel safe and valued, which is important for their mental health well-being.
Inaccessible policies. Inaccessible mental health services in educational settings arise from systemic barriers, including shortage of school psychologists, counselors, and social workers. This shortage prevents many students from receiving the support they need. Additionally, many educators lack sufficient training to effectively recognize and address mental health concerns. Despite their crucial role in identifying students in need, mental health is often not integrated into school curricula or policies. Even though evidence shows that school based interventions can enhance students' emotional well being and academic outcomes to improve accessibility and reduce stigma, it's essential to increase funding, expand the school workforce, provide teacher training, and embedded mental health policies within the educational framework.
Undefined educator roles. As mental health issues among students appear to continually rise, we believe that the undefined roles of educators in schools are becoming increasingly impacted. Traditionally trained in pedagogy, educators are not always equipped with the skills or resources needed to address mental health crises effectively. Their primary role is to teach and guide students academically. Yet, we have noticed that they are often expected to recognize and manage mental health concerns despite not being formally trained in this area. This gap can lead to challenges in identifying early signs or symptoms of mental health issues, providing appropriate support, or connecting students with the proper treatment. As a result, educators may experience burnout from the emotional strain of managing these additional responsibilities without adequate training, support, or compensation. This lack of preparation and resources not only impacts the well being of students, but also exacerbates the strain on teachers, leaving many feeling overwhelmed, unsupported, and unable to fully meet the needs of their students. Potential solutions. Comprehensive training in mental health support for educators can better equip them to support students who present with concerns. This additional skill set broadens an educator's scope of practice and should be considered when deciding compensation and scheduled hours throughout the day. Although mental health can be complex to address, there are things educators can do in the classroom to support learners struggling with mental health and those who are not. Research suggests educators can take mental health training courses to become more self aware in their learners' signs and symptoms. Ensuring a safe space for learners is very important so they feel secure enough to reach out for support.
Another potential solutions, which the goal of integrating mental health and education might be shared by many educators and mental health professionals. There is a little concern on the optimal ways to package or integrate sport within school to achieve these goals. A solution can be implementing pilot program, important implementing these programs in school to test different model of integration. This could help identify effective strategies and gather data on their impact. And also starting mental health buddies in school. Pair students with trendy peers helper who listen and support. Test this in few schools to keep it simple. Check if it lowers stress, boosts grade, and build friendships. Also, quiet concerns in classrooms. Small spot where kids can relax when overwhelmed. Try short feel-good breaks too, like 5 minutes of stretching or breathing each day. Running these ideas together in the pilot school, also students, teachers, and parents, which one would work? Use the answer to find the best mix of mental health and learning help.
The growing impact of mental health issues amongst learners is a serious concern that requires more than the minimum solution. Cultural perspectives are often misunderstood, leading to misjudgment and lack of support. Many learners show signs and symptoms far in advance, but they go unnoticed because of the lack of accessibility to policies or finding outdated policies. When educator roles are not defined, providing consistent support to learners becomes harder. Moving forward, educational facilities should create more inclusive cultural awareness environments, ensure educators are also supported in their field, and create policies that are accessible, transparent, and student centered.